Colin, so you were telling me that about your experience with nasal ketamine. So if you could give me just a little background in terms of you reached the ECT and TMS, and then how you came to ketamine and how you found that to be helpful for your chronic depression.
Sure. Well, I did ECT for about 4 years, so I had almost 200 treatments. And at the beginning, it worked wonderfully, and then as the treatments went on, and we cranked it up to the highest level, and it just started to wear off.
And then you went to TMS.
And then we went to TMS, and
wasn't as effective.
It wasn't as effective, and there were also problems with the apparatus used for my chronic pain that I have in the neck.
So then we start talking about ketamine.
So then we started talking about ketamine, because we had heard about the ketamine infusions that are given, but they don't seem to last very long.
So then with that, we came up with the idea that we could use nasal ketamine for treatment of your chronic, kind of refractory, I think, depression. How's the nasal ketamine worked out for you?
And the nasal ketamine is the best thing that I've used since I've been treated for depression.
In what way?
Well, I've had suicidal ideation since I was about 7 or 8, and this is the first time I haven't. I mean, it's completely gone. No, it doesn't even come up.
Now, a lot of people hear ketamine as being, kind of psychoactive drug or whatever the case might be. Have you had any of those side effects or things like that?
Not at all. When you first do a little spray, you can feel a little. You can feel it. I mean, your head kind of wanders, but it dissipates within 30 seconds.
Right.
And all it does, it actually makes my thinking clearer. And sharper, and I have more energy, not in a sort of agitated or hypermanic kind of way, but in.
So if someone is looking at this video with refractory depression, what would you tell them about nasal ketamine and things like that? Seeing me for that, what do you think about that?
I would say definitely try it.
Right.
I think that it's definitely the best thing. I've tried 28 different psychotropic medications over the course of my treatment over 25 years.
Wonderful.
And this is definitely the best thing that I've ever used.
Excellent. Well, thanks for sharing.
Sure.